In just over 50 years, heart transplant surgery has gone from believed impossibility to medical miracle to near routine operation. Worldwide, around 5,000 people undergo heart transplant surgery each year, and as time goes on, more and more people of older age and with riskier heart conditions go under the knife. With a 1-year survival rates of 90% and 5-year survival rates of 80%, it's clear that these operations are saving many lives. But the story of heart transplants hasn't always been one of success and survival, with the first human-to-human heart transplant being carried out in Cape Town, South Africa on the 3rd of December 1967. The operation was performed at the Groote Schuur Hospital by Dr Barnard, a cardiothoracic surgeon. The patient was Mr. Louis Washansky, a 53-year-old man who was ill in hospital suffering from the complications of heart failure, a life-threatening condition where the heart is unable to adequately pump blood around the body. The donor of the heart was Denise Dovell, who had been in a car crash, with her father agreeing to her heart to be used in the first human-to-human heart transplant in history. But Dr. Barnard didn't just decide one day that he could pull off a heart transplant. After many advancements had been made in the realm of cardiology and cardiac surgery, no real progress had been made in the treatment of heart failure patients. So Dr. Barnard concluded that in order to treat patients with end-stage heart failure, there would need to be a way to give them a new heart, meaning a transplant was required. But before treating any real patients, he would first need to practice and perfect his technique, and like many other advancements in medicine, he ended up turning to animal subjects. Dr. Barnard's animal of choice was dogs. Dr. Barnard didn't choose dogs because he was a cruel man. Dogs have been used as test subjects in science for a very long time, and specifically in the world of cardiac surgery, when in 1905 the first non-human heart transplant was carried out on a small dog. Tragically, many dogs gave their lives unknowingly to the cause of medical advancement, but after perfecting his technique, Dr. Barnard went on to study and gain experience in immunosuppressive therapy based on the treatment of kidney transplant patients down in South Africa. But after putting his newly honed knowledge to the test by performing a successful kidney transplant, Dr. Barnard decided he was ready. Both Louis and Denise were taken to the operating theatre, where Denise's ventilator was disconnected. Denise had been declared brain dead following her car accident, and at the time, in South Africa, a person was legally considered dead if a doctor declared them to be. But to be sure he would avoid any medical legal trouble, Dr. Barnard waited until Denise's heart stopped beating and the ECG showed no cardiac activity before starting the surgery. An ECG is short for electrocardiogram, also known as EKG in some places. It's basically a device that monitors the electrical activity of the heart. After cutting through the sternum, the surgical team cooled the non-beating heart by circulating cold blood around Denise's body with the goal of slowing metabolic activity to prevent ischemic damage due to lack of oxygen. The team then connected the now cooled donor heart to a heart-lung machine so they could keep it perfused with blood while they prepared it to transplant. Louis's heart was then removed and the donor heart was quickly sewn into place. And after re-establishing the blood supply to the new heart and allowing some time to see if the heart was beating strongly enough, Louis was sewn back up and the operation was completed. Although the operation initially looked like a success, with Louis doing well for the first week post-operation, he began showing signs of deterioration due to a lung infection, which unfortunately led to his death on the 21st of December 1967, just 18 days after the operation. It has been suggested that allowing the donor heart to stop beating may have damaged it before the transplant took place, which could have contributed to the negative outcome. But despite this sad outcome, the news of the operation quickly spread around the world, inspiring many other surgeons to try and replicate the procedure in hospitals all around the world, but they all had very poor survival times. Dr. Barnard wasn't deterred, however, and soon performed a second heart transplant with a much better result, with the patient surviving for 19 months before dying from a graft atherosclerosis, a newly encountered complication, also known as chronic rejection. Dr. Barnard continued to operate on more patients, achieving an average post-surgery survival of over 200 days for his first 4 patients. But by Dr. Barnard's 5th patient, he broke the trend, with the patient surviving for 13 years following the operation, and with his 6th going on to live for 23 years following the operation. These success stories were definitive proof that heart transplants could be done successfully. Tragically, many lives were lost, both human and canine, for the knowledge that has been honed over the subsequent years by surgeons, leading to better outcomes for patients and countless lives saved.